To my family, represented here by my sister Maria Elena and my beloved nephew Rene. And also, I want to congratulate you all for your support of the United Nations, because it is very important for the United Nations itself and for the rest of the world. I say this because I have seen the United Nations at work in Colombia. For instance, the Office of the High Commissioner for Human Rights in Colombia, which sends staff members to the most remote areas of the country, listening to the victims with all the respect and consideration they deserve. Or victims of the war going to Bogota, knowing that the Office of the High Commissioner will be carefully listening to them. The office denounces atrocities against civilians, such as massacres, forced disappearances, torture, and what are called false positives, the kidnapping and murder by army officers seeking promotions of young men presented falsely as guerrillas killed in combat. The High Commissioner's Office calls the attention of the Colombian government and its respective institutions to these atrocities. And United Nations personnel have accompanied CSN delegations with personalities such as Noam Chomsky, John Deere, and Roy Bourgeois. The Office of High Commissioner for Refugees tends to the 6 million internally displaced persons in Colombia. This number was the highest in the world until the Syrian war started. These are 6 million persons out of a population of nearly 48 million, the third largest population in Latin America after Brazil and Mexico. Lastly, I want to seek support for the peace process being negotiated in Havana. This is not the end of the war, but the beginning of the construction of a country with real democracy and justice after 50 years of civil war. We have to monitor the way the Colombian government implements the peace agreements, because peace has enemies on the extreme right. We should all be concerned about the military presence of the United States in Colombia. The Colombian government has given the United States government the right to place US soldiers in 7 military bases, which the United States military has promoted as a means to monitor and perhaps control the political situation in countries as diverse as Venezuela, Brazil, Ecuador, Bolivia, and Argentina. This is why I believe that our most important mission at CSN is to educate people in the United States concerning the situation in Colombia. The other principal part of our mission is to accompany rural communities in areas of conflict which are suffering the effects of the war and seek to change the current development model. Thank you all for caring for Colombia. Thank you very much. Thank you.
Stay here.
Okay, thank you.
I'd like to read the plaque that UNA is presenting. UNA USA Dane County Chapter presents the 2015 Global Citizen Award to Cecilia Zarate Laun with gratitude for her work with the Colombia Support Network, supporting Colombian communities in areas of conflict and helping bring peace and respect for human rights in Colombia. Presented this 18th day of October 2015, David Cuter, Chapter President.
Thank you very much.
I I'd now like to introduce Dr. James Conway, who will introduce our keynote speaker. Dr. Conway is Associate Director of the Global Health Institute at the UW-Madison. I was blown away when I looked on the internet and saw who Dr. Conway was. Someone else had arranged for him to introduce, and I need to introduce Dr. Conway, and he's a great person, as many people are at the UW and other schools here. He's a pediatric infectious disease specialist who works both domestically and globally with programs designed to improve the lives of children. His projects largely involve training local professionals in the recognition and treatment of infectious conditions and improving systems for prevention, particularly through strengthening immunization programs. He's been involved with long-term field programs in Thailand, Kenya, and Ethiopia. I welcome Dr. Conway, and I've asked him to say just a few words about the Global Health Institute. We've said mentioned that name several times today, and I think it's worthy of a few words to explain it so we all know what it is.
Thanks, Todd. Thanks very much, Todd, and I'm humbled, I think, to first of all have an introduction like that, but more importantly to be in a room with what I really consider a whole room full of global citizens. And although we have one of the great ones here, all of you really need to be commended and thanked for all the work you do to help the UN Association. As Todd mentioned, I've worked in immunization programs for many years and have actually benefited from close collaborations with the UN and UNICEF and a number of other organizations. And I think it's important for all of you to know how broad and how important those programs are. As Todd also mentioned, I am fortunate to be part of a really remarkable and groundbreaking program here at the University of Wisconsin-Madison, which is the Global Health Institute. And we've actually been very pleased and happy to be co-supporters of this project and actually brought along quite a few members of our group. So I'm going to ask real quickly for those of you who have anything to do with the Global Health Institute to please just raise your hands and show where you are. Yes, you too, Karen, everybody. So we've got a large group of people here. And I want to encourage you to take some time to talk to them as well about many of the programs that we're involved in. The Global Health Institute is really a novel program. Global health is obviously a very popular term at universities around the country, but the University of Wisconsin-Madison is really a unique place for this to land. We're one of the few universities that has collaborations across all disciplines, including everything from animal science and animal health and veterinary medicine through climate change and environmental issues into the humanities, largely based in the idea of interdisciplinary collaborations to try to make sure that we're both not recreating the wheel, but also really understanding the upstream determinants of why health disparities exist and what we can do to really improve the wellness, not only of all the people on the planet, but of the planet itself and the animals and everything else in our environment. And so we've really embraced this and found ourselves in a really unique opportunity at this university that really supports these kinds of novel programs. It may be a state university designed to help Wisconsin, but it's fortunate that the leadership have recognized that Wisconsin is part of the world, and the well-being of Wisconsin and the well-being of the world are all tied together. So we have a really fortunate collaboration and really a broad interdisciplinary approach to really understanding these problems, and then trying to work together with partners in country to design cost-effective interventions and cost-effective problem solving that leave the power with the people that actually live with the problems. And you have to remember that although global often is equated with international, global is really domestic and international. And we are a global population here in Wisconsin with many needs, many underserved populations here. And so we actually learn a lot from the populations we work with and bring those ideas and solutions home to help the people of Wisconsin. So that's the Global Health Institute in a nutshell. And obviously we've been incredibly fortunate to have a long relationship with our next speaker, Ambassador John Lange, who's a senior fellow in global health diplomacy at the United Nations Foundation. I've known John for some years, and I'll tell you that the first time I met him was when he was giving a talk at the law school about pandemic influenza. And for an infectious disease specialist, I was frantically sitting there with my phone Googling, trying to figure out how somebody without any MDs or MPHs or any letters after his name could have such a deep understanding of the importance and the complexities of influenza and infectious diseases. And as I've come to know him and come to know more about him, I've realized that this is one of these really thoughtful, incredibly impressive people who has really, in fact, made me very proud of the U.S. government and our diplomatic corps, because they really are, in fact, populated by very important people that do amazing work. If I read his entire biography, we'd all be here into at least the second half of the Packers game, and I know as a native Milwaukeean and a Packers fan, he'd like to at least see if we can catch some of that. A couple things just to make sure I highlight. First off, he is a proud Badger and not only has an undergraduate BA in political science from here, but a JD as well, and he actually graduated cum laude, and he also has a master's from the National War College. He's been in the diplomatic programs for at least 28 years, and if I read all the things that he's been involved in, it would really take a lot of time. He was the ambassador to Botswana 1999 to 2002 and led many of the programs related to the response to the HIV epidemic as well as other infectious disease issues across history. He spent 4 years at the Bill and Melinda Gates Foundation really working on sort of designing and helping implement governmental and intergovernmental collaborations across the world. But for a career that has really spanned multiple decades and in multiple roles really supporting health programs, I think the most important thing in my mind is that John Lange is really a champion for global health and was one of the very first people that actually brought this to the conversation in understanding this idea that health should be part of all policies, that all governmental and non-governmental policies should really have something involved in how is that going to affect the health of the communities, the health of individuals, and the health of the environment. And I think that's probably, if anything, the legacy that I think that we all need to appreciate. So he's going to speak about all sorts of things related to his career and his views on global health. And I think we're all very privileged to be in the presence of somebody who's another one of these great global citizens. So join me in welcoming John Lange.
Thank you very much, Jim, for that very kind introduction. I want to have the water here. I may be a little hoarse at times because it was a little cold out at the football game yesterday for any of you who spent the day, and I was in the shade in the south end zone. So, but it's a delight to be here, and I really appreciate the invitation from Dave Cuter and the Luncheon Planning Committee to be with you here today at the luncheon to celebrate the 70th anniversary of the United Nations. Happy birthday, everybody. I'm also impressed by the large turnout, although as you've heard a couple times, the Packers started at 3:30. About a month ago, I was in Washington, and Barbara Nichols told me that she was receiving an RSP every day from my relatives. So, hello relatives, they're here too to pad the audience. In that nice introduction from Jim, he actually missed three things that you may find interesting. In 1969, I attended the Wisconsin University's United Nations Summer Seminar in New York, 8 weeks in New York. And for those who really recall the University of Wisconsin merger with the Wisconsin State University System, this was even before the merger, which is why it was called the Wisconsin University's UN Summer Seminar. In 1970, I'm proud to say I was Secretary General of the University of Wisconsin Model UN. And in 1971, I joined the Dane County chapter of UNA USA. I ended up leaving Wisconsin to move to work for the national office of UNA USA in 1976, but I still feel it's wonderful to be back home. And I was really pleased to see Heidi Gutmann earlier, who's the daughter of Professor Llewellyn and Gretchen Pfannkuchen, who were really mainstays of the chapter back in the 1970s. I feel in some ways that my career has come first full circle because now I'm at the United Nations Foundation, which was founded by Ted Turner in 1998 when he gave his $1 billion gift to the United Nations, $100 million a year for 10 years. And he quickly realized you just can't write a check to the UN. You have to have a vehicle to use for that check, and that's when the UN Foundation was created. And now UNA USA is part of that. I'm not sure you're all aware of this, but to mark the 70th anniversary of the UN, UNA USA has launched what they call the Eleanor Roosevelt Fund to build on her legacy as a full-time volunteer and board chair of UNA back in the 1950s. And the goal is to connect an entirely new generation of young Americans to the mission and the work of the UN, including helping Model UN reach thousands of new students through a new in-classroom curriculum. And it's also worth pointing out that the University of Wisconsin, of course, continues to cultivate international scholarship and engagement, promote global awareness, and prepare students for a diverse and interconnected world. I felt it did that for my education back when I got my bachelor's degree and then law degree. And it does that now, and I'm really glad to see Professor Guido Podesta here, who's the Dean of the UW International Division. A really top-notch group of people. I'm here today to talk about global health and sustainable development, and I'll talk about the Millennium Development Goals and the Sustainable Development Goals that follow them, but much of the focus will be on global health. It's really, there's been an explosion of interest and support and funding for global health programs over the last 15 years. To kind of put this in perspective, I thought I'd describe a bit of my experience when I became the United States Ambassador to Botswana in 1999. When you're the United States Ambassador, you look at the whole range of U.S. national interests, and you try to determine where you can advance those interests. And I had earlier in my career lived in West Africa, in Togo, and in East Africa, in Tanzania. This was my first posting in Southern Africa. And Botswana is a wonderful country. It's about the size of the state of Texas, but only has a couple million people. Very successful. It's been a long-standing democracy, really since its independence in 1966, even though it's been dominated by one party, but still it has free elections. And one of the reasons the party continues to win elections is the economy has progressed so well. When you enter Botswana, when I was there, you'd see at the customs and immigration crossing big sign that said Botswana has zero, capital Z-E-R-O, tolerance for corruption. And there are some other countries on that continent that couldn't say the same. Now, that didn't mean they had no corruption, but it was at quite a low level. It was basically good governance, and what happened was they had diamonds, but they used them well. Some people would say that the luck was that they found the diamonds after they became independent of Britain rather than before when they were a protectorate, because the colonial powers didn't always do favors for the countries involved. And they ended up running the operation which is called the Debswana Diamond Mining Company as a private entity. It was half owned by De Beers, Anglo-American, and half owned by the government of Botswana. And I once took a tour of the diamond mines, and you'd see these huge Caterpillar vehicles with where the tires would be about 10 or 12 feet tall that would take the diamonds out. And it had a competent military under civilian control, a relatively free press. All of these things that are just wonderful, and that you feel very good if you're the United States Ambassador to be posted in such a positive country. With one exception, 38% of adults aged 15 to 49 were estimated to be HIV positive. Later on, they determined that that was more likely 33%. But basically, 1 out of every 3 adults you met was HIV positive. And the only way you could be tested for HIV was to have your doctor take a blood sample and ship it to the neighboring country, South Africa, to be tested. So I made it my signature issue, because that was the one big concern for the U.S. government, HIV/AIDS. And working with the head of the CDC, the Centers for Disease Control and Prevention Office in the embassy, and with the U.S. military, which provided funding for the structures, we built a series of voluntary counseling and testing centers so that the people in different parts of the country could at least be tested. And I virtually never gave a speech that didn't include HIV/AIDS as part of the message, even if I was talking to military officers or police officers or others. It was really a sad, sad situation, and there was a lot of denial, a lot of stigma attached to HIV/AIDS, etc. At that time, it was so bad that later Dr. Max Essex and Unity Dow, Dr. Max Essex from the Harvard AIDS Institute, and Unity Dow, a very prominent judge in Botswana, wrote a book called Saturday is for Funerals, because you could just see the funeral processions going from the capital city, Gaborone, to the rural areas, to the home went for people who were dying. And similar disasters were taking place elsewhere in southern Africa and the world. And that was something that was really catching the concern around the world, because it was before antiretroviral therapy became readily available. So you had the antiretroviral therapy, when I got there in 1999, cost $10,000 per person per year. So it was totally unaffordable to the vast majority of people in Botswana, even though that was the one thing you had to have to make this a chronic disease that would allow you to live indefinitely. Some of you may recall that in January 2000, the United Nations Security Council, led by the United States and with the presence of the Vice President Al Gore, they met to discuss the impact of AIDS on peace and security in Africa. And that debate was the first time in history that the Security Council of the United Nations discussed a health issue as a threat to peace and security. The Secretary General of the United Nations at the time was Kofi Annan. He's now a member, actually, of the UN Foundation's Board of Directors. And he said at that time that the impact of AIDS in Africa was no less destructive than that of the warfare itself. By overwhelming the continent's health services, by creating millions of orphans, and by decimating health workers and teachers, AIDS was causing socio-economic crises which in turn threatened political stability. In already unstable societies, that cocktail of disasters was a sure recipe for more conflict, which in turn provided fertile ground for further infections. So given this really scary state of the spread of HIV/AIDS and far beyond southern Africa, the world responded. And that's really, I think, a very positive message when you look at the positive growth of programs, particularly in global health over the last 15 years. The United Nations in the year 2000 established the Millennium Development Goals, MDGs. I'm sure you've heard of them. Three of those goals were specific, three of the 8 goals were specific to health, to reduce child mortality, to improve maternal health, and to combat HIV/AIDS, malaria, and other diseases. And governments, the United States included, really responded by creating new, highly effective organizations that were focused on improving public health. Many of these are kind of vertical programs, as they say, focused on a specific disease or condition, but they've been highly successful. You had the Gavi, the Vaccine Alliance, created in the year 2000. The Global Fund to fight AIDS, TB, and malaria was created in the year 2002. The President's Emergency Plan for AIDS Relief, known as PEPFAR, was created in 2003 by President Bush, and it's still called PEPFAR. President Obama kept that name, and it's now at the rate of $6 billion a year for this, of U.S. government taxpayer funding to save lives. The U.S. President had the Malaria Initiative in the year 2005. Where I worked for 4 years, as you heard, the Bill and Melinda Gates Foundation was created in the year 2000 and gives over $2 billion a year just for global health purposes, plus about another $1 billion for other development purposes in U.S. education. And if we're going to talk about the explosion of all these institutions, we should talk about the Global Health Institute here at UW-Madison that Jim Conway was talking about, and it's good to see Director Jonathan Patz here. Their goal is to serve as a catalyst, a convener, and change agent supporting theme-based initiatives globally and locally to improve the health of humans, animals, and the planet in a sustainable manner. And one of the things that you heard from Dr. Conway was how that they really do bring an interdisciplinary approach, because a lot of the global health efforts at institutions and universities don't focus so much on what is called the One Health concept, connecting animal health and human health, because there is a connection there, as we've seen from Ebola and SARS and other diseases. In this time period, development assistance grew rapidly. It's not just creating these organizations, but money that went to these organizations. From the year 2000 to 2010, the amount of assistance went up over 11% each year on average. But I have to say, since 2010, development assistance for health has increased to just about to less than 1.5% a year. So that's an indication maybe that we're at a bit of a plateau in the global health funding. So look, with all of this expansion over the last 15 years that I've been describing since, which really was after I first arrived in Botswana in 1999, where do we stand? Well, when you look at the Millennium Development Goals that the UN created, and specifically the ones on health, goals 4, 5, and 6, the goal to reduce child mortality. Today, 17,000 fewer children die each day than in 1990. It's quite an astounding figure. But over 6 million children still die each year before their 5th birthday. So there's a lot more work to do. On maternal health, maternal mortality has fallen by 45% since 1990. But only half of the women in developing countries receive recommended health care during pregnancy. Still more work to do. And to combat HIV/AIDS, malaria, and other diseases, the access to antiretroviral therapy, which I was mentioning earlier, for those who are HIV infected has increased dramatically. The prices have gone way down in the hundreds of dollars now rather than $10,000. And a total of 9.5 million people in developing countries receive treatment each year, or treatment actually each day. But every hour of the day, 50 young women are newly infected with HIV. So again, more work to be done, but great progress. Global health in the year 2014, global health assistance, known as development assistance for health, was at the level of $35.9 billion. And that does not count the domestic contributions that governments are putting in more and more to pay for their own health programs, especially as countries in Africa and elsewhere progress. In my view, there's also there's a lot of success out there, but there's also a fundamental change in the way governments are looking at these efforts to strengthen global health. And that is by focusing less on those vertical programs that I talked about, the ones that are oriented toward a specific disease, and looking more towards strengthening health systems broadly. Looking at it more holistically within the human health context and beyond. There was the Lancet Commission on Investing in Health that developed a new investment framework to achieve dramatic health gains by the year 2035. And their report is called Global Health 2035, shows that we can achieve dramatic gains through what they call a grand convergence around infectious disease and child and maternal mortality, a more comprehensive understanding of the returns to investing in health, major reductions in non-communicable diseases and injuries. And I have to say, if you went back 6 or 8 years ago, few people were talking about non-communicable diseases in the global health community. Now there's much greater concern for things like reducing, doing a lot more to reduce tobacco consumption to prevent cancer, diabetes, etc. And there's also the promise of the Lancet Commission pointed out, of universal health coverage, which they thought of as very pro-poor, to try to help the poorest people. There's also an increasing understanding that these vertical programs have fundamental limitations. As vaccinated children become adults, as women deliver children but then grow older and become grandmothers, as HIV positive patients who are on antiretroviral therapy grow older and suffer from other diseases, they all need quality healthcare services that vertical program can't really provide. In some cases, this means that these vertical programs need to put more emphasis on how they help strengthen a health system through what is sometimes called the diagonal approach. And the other aspects are actually more concerted effort for things such as universal health coverage. The prestigious National Academies of Science has the U.S. Institute of Medicine. They released a report in 2014 on investing in global health systems, sustaining.
To my family, represented here by my sister Maria Elena and my beloved nephew Rene. And also, I want to congratulate you all for your support of the United Nations, because it is very important for the United Nations itself and for the rest of the world. I say this because I have seen the United Nations at work in Colombia. For instance, the Office of the High Commissioner for Human Rights in Colombia, which sends staff members to the most remote areas of the country, listening to the victims with all the respect and consideration they deserve. Or victims of the war going to Bogota, knowing that the Office of the High Commissioner will be carefully listening to them. The office denounces atrocities against civilians, such as massacres, forced disappearances, torture, and what are called false positives, the kidnapping and murder by army officers seeking promotions of young men presented falsely as guerrillas killed in combat. The High Commissioner's Office calls the attention of the Colombian government and its respective institutions to these atrocities. And United Nations control the political situation in countries as diverse as Venezuela, Brazil, Ecuador, Bolivia, and Argentina. This is why I believe that our most important mission at CSN is to educate people in the United States concerning the situation in Colombia. The other principal part of our mission is to accompany rural communities in areas of conflict which are suffering the effects of the war and seek to change the current development model. Thank you all for caring for Colombia. Thank you very much. This is not the end of the war, but the beginning of the construction of a country with real democracy and justice after 50 years of civil war. We have to monitor the way the Colombian government implements the peace agreements, because peace has enemies on the extreme right. We should all be concerned about the military presence of the United States in Colombia. The Colombian government has given the United States government the right to place US soldiers in 7 military bases, which the United States military has promoted as a means to monitor, and perhaps personnel have accompanied CSN delegations with personalities such as Noam Chomsky, John Deere, and Roy Bourgeois. The Office of High Commissioner for Refugees tends to the 6 million internally displaced persons in Colombia. This number was the highest in the world until the Syrian war started. These are 6 million persons out of a population of nearly 48 million, the third largest population in Latin America after Brazil and Mexico. Lastly, I want to seek support for the peace process being negotiated in Havana.